I'm now going to do a demonstration for you. This is not an exercise, but a demo of the lip bumper. The instruments that I'm going to use in this exercise include the long nose bird beak, a Weingart plier, a flat tip Mathau plier. This is a 3-prong clasp plier, or it's also known as the titanium expander adjustment plier, a hollow chop plier, a pin ligature cutter, got the band pusher scaler and a ligature director remover, 012 steel ligature ties, cat whiskers, light 1/4-inch elastics, a typodont that still has the previous exercise on it, because the lip bumper is usually installed right over the top of an existing arch wire or utility arch wire system. And then this is the lip bumper. Let's take a quick look at that. The lip bumper here is a number 2 size. This is a wide lip bumper. They come in thick and thin, so this is a thick lip bumper. You buy these in kits, and you can get a range of sizes to work with. And the only difference between thick and thin is this plastic rubber area here. On the thin, it's just a little bit bigger, like a sleeve over the wire. On the thick, it's much broader like this. And I usually, if I'm going to use these at all, I'll usually use a thick one. Alright, to begin adjusting a lip bumper, the first thing we're going to have to do, of course, is just take off the label, number 2 label. And if you were trying this in the mouth and you first started working with it, you might even do a wax imprint of the lower arch and then start just laying down, superimposing this on the wax imprint until you find the lip bumper that's closest. In this case, we've just been issued the number 2, which is pretty much the right size for our typodont. But the first thing you'll have to do is you have to insert it and see how it looks on the lower arch. So it's going to insert. You can see you've got an 040 wire. This is made out of the same wire that Big Daddy is made out of. It's very heavy wire. It's going to fit very snugly into the headgear tube. So slide it like that. Then you've got this Omega, which is an adjustment loop and a hook to tie these in or to use elastics with. And then as we come around, you can see the lip bumpers here and here. And then we come on around to this side and we've got the same Omega adjustment loop. But look at our distance. So we know we're going to have to reshape this to get this to lay passively and slide into that tube. Now, frankly, the easiest way to do this is just to adjust with your fingers. There are 3 basic things you're going to have to consider whenever you're adjusting these. That one is just that lateral position. Do I need, transversely, do I need to expand it or contract it? Well, we know we needed to contract it because it was sticking out too far. The other thing you have to look at is the arch length. Like, is it sticking way out here? And if so, I will have to take up some length on using the Omega loop. You always adjust length, the arch length of this, using the Omega loop. If you go in and you try to use, like, I love this for adjusting it. This is the titanium paddle expander adjustment plier, and it's just a very heavy 3-prong. It works very well for this type of wire. And you should always make all of your arch length adjustments right here on that Omega. Do not come up here and try to make adjustments in the front. Even though that's tempting, don't go there, or this will happen. You'll get a fracture, and then you get to get another. They get to sell you another one. So don't adjust in the front, only on those distal ends, distal legs. Okay, so we looked at this. We know that this one is too wide, so I'm just going to be reshaping this to try to make it fit better. And it looked like I already did some good, but see, now I'm closer. Just got to do some more. And it is not the easiest thing to bend, so I'm going to flatten that out. Now see how these omegas are kind of rolled in? You may have to roll them out. And when I need that, I choke up on this end of the bird beak, and I grab it like that, and I just roll it out like that. I'll do the same thing over here. Just grab it with that right next to the jaw and just roll it out. And you may, and that, again, this wire is really, really, really stiff. And then we'll try it in again. And again, like I said, if you were working in clinic, you might want to work with a wax pattern. I'm going to grab a Weingart to insert this. Now let's look at it again. With it, it's still not lying passive, and it's really too far out away from the lower teeth, and so I'm going to make more adjustments. And initially I want this thing to lay right there along the front of the wire, the existing wire, but depending on what we want to do with it, we'll have to adjust its height. And you always adjust the height of it, again, back here on the omega. You just simply change that angle of that right on that end that inserts into the tube, the buccal tube. You're just going to change its angulation, and that will raise or lower this front end of this. And you just have to work with them to get the hang of it. We know that this is standing out too far, so I'm going to close these loops a little bit. Now, in order to do that, use the jaws just like this. I'll go with a different direction here so you can see better. Now see what I've got? I'm using right there, there's a indent where those jaws fit on that. If you squeeze too hard, you will just bend the wire completely in two. So you have to be very, very slow and deliberate. See, I just barely worked on it, and then I'm going to flatten it back out by coming over here and close that just a little bit. I'm going to do the same thing over here, and all I'm doing is I'm shortening this length so it'll bring that bumper closer to the teeth. You only want it to be about 2 millimeters off of those teeth. So I'm going to close this, and I'm going to flatten it out a little bit. And now we'll try it back in again. Now, as you can see, we're a little closer, but we're low. But that's okay, because sometimes you want it to be low. It depends on what you want it to do. I'm going to show you. This is going to be in your manual. Here's a chart. I'm going to show you real quick what the page is going to look like. Here's a chart that shows you the basic distance away from each of these. I want 5 millimeters off of the bicuspids, 3 millimeters off the cuspid, and 2 millimeters off the incisors would be ideal. And then as it just sits there, it keeps those lips out of the way. The tongue pushes these forward, and you get a nice arch form. This is usually used in a mixed dentition scenario, so you might have a utility arch wire system in here, and then this would be right over the top. Norm Setlin is the doctor that was the lip bumper king, really, and he believed that you could leave these in and that the patients could, he never tied them in. The patients were instructed on how to place them, and they wore them, and as they wore them, the strength of their lip would push the molars back and allow the incisors to flare. Now, some doctors would prefer to tie these in. I'm going to show you how to tie it in so the patient cannot remove them. The problem with that is just hygiene. It's hard to clean around them. So it's kind of a give and take. You're going to get better results from the lip bumper orthodontically, but you're going to lose some ground periodontally if they're not really thorough in cleaning around it if you tie it in that way. And it's usually, as it says here, 9 to 12 months to get any expansion and get the movements that you want. Now, the other chart I want to show you is this, and again, it's going to be in your manual, but depending on the height, see how high this is? If I placed the lip bumper where it was right up here next to the incisal edges, that would be trying to upright first molars. So it would be kind of distalizing, would be its primary objective, because they push high on this, it's going to rock that molar back and gain some space. If you move it down here, it's just going to basically hold the molars where they are, keep the lip off the teeth, and allow them to, it's not going to allow much movement on them, and it's going to give you a little bit more, it would be like a frelau. It would just kind of hold the molars in place. Maybe you would use it in a scenario where the kid could not stand your fixed removable lingual arch. There are a few out there that just can't tolerate them, and then you could try to encourage them to wear this. I can't imagine somebody liking a lip bumper better than a frelau, but that's the scenario. And then finally, if you want the anteriors, the front teeth, to actually move labially, then you're going to be placing this lip bumper at the middle third of the crown up here, but it's going to be out away from those teeth, and the tongue is going to push this tooth toward the lip, and you'll get some flaring that way. So let's go ahead and tie this in. You could tie it in with an elastomeric, but I don't think that would necessarily get the job done. If you had a rubber band, they'd probably take it off. So you got to go back and catch a molar hook and get under that. So do you see where I'm at? I've got the molar hook and I'm coming under their hook on the lip bumper itself. Tying it in this way, there is no way that a kid is going to get this out. Get a pin and ligature cutter and clip this. Alright, let's do the other side, and then we'll tuck our pigtails here. Just catch a molar hook, get under that omega adjustment loop, come over and catch the hook. And this hook is also where any of your elastics that you're going to wear would be placed. So again, we'll clip, get a band pusher is my favorite for tucking these pigtails, but you can also use the tool is the pin and ligature director. There's no rule about pigtails. You just try to tuck them in where they're not going to get pushed back out and get the patient. You just try to tuck them someplace that's out of the way. Now finally, let's talk about using this appliance as a distalization appliance. Dr. Norm Setlin believed that just the proper placement of this and the pressure from a hypertonic lip would actually push those molars back and distalize. But a lot of doctors believe that the only way you're going to get distalization with this appliance is with elastic. So you can start with light elastics, and you're going to catch this hook, and it probably, in this case, usually it's mixed dentition, so you don't have the 7s. So because they're not 12 years old, they've still got primary teeth, but they'll have the 6s, so you can go here. But if it's that distance, then you're going to have them wear about 3 light 1/4 inch elastics. Because it's such a short distance. But doing that will hold this back, and all the pressure from the lip and these class 3 elastics will drive the molar back, and you will get distalization that way. Do the other side. Oh, I'm not orienting that very well. And you could use more or less as you see fit. Bottom line is that by using this appliance this way, you'll get distalization of the lower molars, the 6s. That will create space in the arch, and these teeth will have more room to come in. So it was a way to gain space in the lower arch, a way to get rid of a hypertonic lip, especially a child who is sucking their lip. It would also come in really, really handy if you're not having a lot of luck with other appliances, and you're trying to get the 2s in and they're blocked out and just don't have any room transversely. Sometimes just by increasing the arch length, you'll be able to get more of the incisors in. So it is a good appliance. It's not something I use on a regular basis because they're not terrible. They're just not very comfortable. But they have been employed for years and are very effective appliance. And that concludes our exercise.